I'm Sue Elliott.
And I'm Ed Holen. Welcome to this week's edition of the Olympia Insider and the Supported Living Rally that's happening today.
Supported living providers across the state really are in need of a wage increase for the direct care staff. And they got a small increase last year, but they needed a bigger bump. Also, they need resources to pay for the health care.
Our supported living providers provide up to 24 hours a day, 7 days a week, support and services to help people with developmental disabilities live out in the local community. It's hard work, and they should be paid equal to the hard work they do.
One of the things that we're finding is there's about 30 people who live in our state developmental disabilities institutions that want to move and can't. And I think, Ed, we're just sitting on an offset lawsuit ready to happen.
Let's cut away and listen to some of the speeches and some of the words that were shared at the rally.
With this rally, we're hoping to bring attention to the severity of funding issues that we face. For example, in the past 7 years, we've had 2 decreases in funding, and only in the recent 2 years, 2 small increases, which now have put us back to funding levels that we received in 2009. This underfunding of supported living programs has created a placement crisis whereby staff turnover is so great, we're not able to support all the individuals that have been approved for supported living services.
We have staff that have children that are sharing apartments with another family with children because they can't afford to pay their own apartment bills themselves.
That's crazy.
Our clients get used to trusting our staff, and then one day when they ask where they're at, we have to say, they quit, they're gone.
And we need to make sure that we up your pay per hour to make sure that you get some relief for that. Make sure you don't feel as much of a squeeze. Make sure your clients are most vulnerable and their families don't feel the squeeze either.
People out here really encouraging support for not only for the workers, but of course for those with disabilities who really need care. And what I really wanted to focus on was the squeeze that I know everybody is feeling.
Great job. Thank you very much.
As a legislator, we're feeling the
Our next
squeeze.
speaker is a mother of an
That's
individual
nothing
supporting
compared
and
to the
supported
squeeze
living.
that people in the community are
Please
feeling
welcome
around
Megan
trying to
Beebe.
find good care and enough caregivers. And then, of course, for the caregivers themselves to make sure that they can do their work at the same time as taking care of their families.
Was about a year and a half ago. I have a 22-year-old son.
So what can other advocates do to share that message with their legislators?
Really talking about those personal stories. I think lobbyists do a great job sharing the data and the stats and the facts, but having that heartfelt, that personal story of the situation that's going on for them or for their client really is something that legislators can picture in their minds and take to heart, truly to heart.
Well, thank you.
You know, we're in a very short session of the legislature, but for a short session, there are an awful lot of bills.
I know we've been really surprised, but I think probably the main reason for that is because it's also an election year for House members, and they maybe want to show their constituents that they, actually get things done.
Check out the Arc of Washington website, the Bills of Interest. The website is www.arcwa.org.
And remember,